If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES 243-3937 for more information.
It is time for 15 of the healthiest minutes you will ever hear on 100.7 QFM, being sponsored by the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation. Good afternoon, Q family. This is Peter Boyce here. Only 6 more days before Christmas.
I feel Christmassy!
But don't get excited and tied up in all the Christmas activities and forget your health, and that is why I am here to remind you that if you are diabetic or pre-diabetic, the Maria Holder Diabetes Center is there for you throughout Christmas and beyond, located in Warren, St. Michael, right behind Eunice Gibson Polyclinic.
I know where that is!
That is where you will find him. Just like how Q is good for you, the Maria Holder Diabetes Center is good for you too. With all the diabetic services you will ever need all in one place, you don't have to spend any money to go anywhere else.
That's good for me, cause there's only one bus fare.
There you can find vascular screening for if you feel you have bad circulation. You should go and get that checked out early. There's also eye screening for diabetic retinopathy. Once you are diabetic, you're supposed to do that every year. Not every other year, you know. Every year, so make sure and make that appointment today. 417-0305.
So about your foot?
Thanks for reminding me. They also have foot care as well, because foot care is very important when you are diabetic, and that is why they have podiatrist Louise Robinson to look after your feet. You will hear from Louise later in this program. But today, we will start out by focusing on your diet. No, don't turn off the radio, because I know they got a lot of people that don't like to hear about diet around Christmas time. But the good thing about Victoria Cox, dietitian at the Maria Holder Diabetes Center, is that she tells you what you can do to make your favorite Christmas dishes healthier. For instance, Jug Jug.
I would really like to know how to make Jug Jug healthier for true.
Well, let's hear from Victoria Cox on that, and also some tips on how you can eat for Christmas in general.
When we have the conversation about healthy eating at times such as Christmas, something I just first like to remind people is that eating maybe a little bit less healthily or eating things that you don't usually eat, if only on one day, is less likely to have a significant impact on your overall health. However, it's when we sort of drag this, Christmas eating out over the whole month of December, so starting from Independence right the way until, after New Year's, that the additive effect of this less healthy eating is going to, ultimately affect our health. And so it's just something to be mindful of, that you really want to try and save special dishes, special treats to, maybe actually Christmas Day itself, and try and isolate these incidences rather than drag it out for the entire month. So in, being asked, okay, well, how can we make something like Jug Jug a healthier dish? I have to give the disclaimer that I am not a chef, but anytime you're looking to sort of healthify a recipe, you want to break down the components of the recipe and kind of think about, well, what are the healthiest parts that you can play up and what are maybe the less healthy parts? So at its core, you think, okay, well, Jug is going to be a dish that is based on pigeon peas. Peas, legumes, they're great for you. So that's not the problem. Where you think, some of the unhealthier aspects may come into play is going to be if salted meat is used, if fattier cuts of meat like pork are used. So, again, that's going to be a high fat content, high sodium content. So the things you can kind of consider there would be, is it possible to make the dish without salted meat at all and just use fresh meat? If you do use salted meat, obviously you want to be sure to really soak it as best you can to try and decrease the sodium content. You can also consider maybe using leaner meat. So Again, I'm not a chef, but I have seen some recipes out there that substitute pork or red meat with chicken, for example, or in the very least using lean cuts of pork. So just trying to, break the recipe down into its components and think about what you can play into, aka, the peas, the herbs and spices, and what maybe you can cut down on. And again, it could just be that you maybe use less of certain meats in the dish, just in terms of shifting the proportions a little bit so that it does lean more towards the peas and less reliant on any kind of meat itself.
Share the joy of giving this Christmas. This holiday season, honor your loved ones with a gift that truly makes a difference. Donate to the Barbados Diabetes Foundation in their name and receive a beautiful certificate of appreciation to share. Your donation will support and empower those living with diabetes in Barbados. Give health. Give hope. Give back. Call 417-0305 or email info@barbadosdiabetesfoundation.org to make your donation today. Together, let's make this Christmas unforgettable.
That's a good gift suggestion there for persons who might be listening to 100.7 QFM and might be looking for that unique gift to give your loved one. There's no minimum amount that you have to donate. You can also pay in advance for a person who might need a diabetes service, and that can be your gift as well. A gift of health. Call the Diabetes Foundation for more information as we go into our Q Christmas song of the day. This is Trinidadian Calypsonian Crazy, but in some Jesus in Your Christmas. Compliments, the Maria Holder Diabetes Center.
Jesus in your Christmas, Jesus in your Christmas this year. Came down here to save us from wickedness and chaos. Put Jesus in your Christmas this year. Put Jesus in your Christmas, put Jesus in your Christmas, put Jesus in your Christmas this year. Came down here to save us from wickedness and chaos. Put Jesus in your Christmas. Put Jesus in your Christmas. Put Jesus in your Christmas this year.
Season's greetings from the Maria Holder Diabetes Center.
After we done connive, fornicate and blaspheme, come the month of December, you come up with your quattro and parancalypso, you shake up your latido. Put Jesus in your Christmas, put Jesus in your Christmas, put Jesus in your Christmas this year. He came down here to save us from wickedness and chaos. Put Jesus in your Christmas this year.
As we continue on the Maria Holder Diabetes Center radio show, it's time to talk feet with podiatrist Louise Robinson. We asked Louise to comment on what are the life expectations of a person who has had their feet amputated.
You normally only expect to live for another 5 years after that, and I can find the statistics on that. That is why we're trying to get a grip of this worldwide epidemic, because it's everywhere, on the country, on the world, and we're not doing enough prevention. So when people are having the limbs cut off, it's usually because the sugar levels have gone far too high, and then when your sugar levels go high, it affects your kidneys. So it's not diabetes itself, it's one of those other conditions that kill you. It's your circulation kills you, or the infection will kill you, or your kidneys will kill you, or you'll have a stroke, and that's what happens. People forget about the feet, but once that circulation's gone, they're coming to us when it's too late. They need to be having the feet checked. As soon as they hear they've got diabetes, people should have the feet checked, along with their eyes, along with the kidneys, along with the heart, because I can guarantee it's always the feet that go first. And once that goes, and once you start losing sensation, which is feeling in your feet, you never get that back. And people are never told this. Once it's gone, it never comes back. And then it's just a downward from there.
Thank you, Louise. We just heard Louise mentioning your kidney, which leads us into our next segment with Dr. Diane Braffett with focus on chronic kidney disease.
Chronic kidney disease, or CKD, what is it? It means that you're entering into a situation where there is damage to the kidney, which oftentimes is irreversible. Chronic means that it happens a little bit slower than something that's acute, meaning that happens all at once. Many of the acute forms can be reversible, but not all. And yes, diabetes and hypertension are the leading causes of chronic kidney disease worldwide, and of course in Barbados as well. I went to a very interesting lecture last night, and if you're living both with diabetes and hypertension, obviously if not controlled, you're actually more likely to get chronic kidney disease than if you just had one or the other. Okay, so once again, it's about taking care of yourself. What are some interesting terminologies that I want you to understand or start to understand? You should be screening for chronic kidney disease based on the frequency in our population. We don't have great numbers, but some of the information is possibly suggesting that they're seeing signs of chronic kidney disease. Hold on to your seats in almost 1/3 of our population. Now, that was not just stunning to me, because in our clinic, among our persons living with diabetes, we see rates above 1/3. But if you're getting that in the general population, mind you, these are not formalized results. The screening might be skewed because it might be people who have a history of diabetes and hypertension, or who have a family history of kidney disease, who are going to get screened. But what this made me realize, in a way that I want to impress so strongly, I mean, I knew it, but I want to impress it on Barbados. You need to take screening for diabetes, high blood pressure, kidney disease, and the complications of diabetes seriously. Even if you're not living with diabetes, you need to screen yourself for hypertension, chronic kidney disease, and of course, pre-diabetes and diabetes. You will hear me say over and over, pre-diabetes is not a benign condition. Now, the beauty of screening for chronic kidney disease is that if you pick it up very early, there are things that can be done to reverse the process. If you pick it up late, and interestingly, too many people are picking it up too late, there is often nothing that you can do to reverse the progress. And in some cases, it will still progress on to end-stage kidney disease requiring dialysis. So that's my tidbit on chronic kidney disease for today. I'm not going to overwhelm you, but as I said, chunk-size information, and in the coming weeks, we're going to keep giving you chunks and chunks and chunks as we at the Maria Holder Diabetes Center for the Caribbean aim to help to empower you, but also we want to help you take better care of yourself. You can come into the foundation or the diabetes center in Warrens, and you can get your diabetes screening. You can get kidney screening done, which is going to be a combination of urine testing and blood testing, and also get your blood pressure and your cholesterol checks. So let's give ourselves that gift for Christmas or the New Year's, and that's the gift of health, the best gift you can give to yourself. Bye-bye.
I have had diabetes for just about 8 years now. I got it when I was really young. I can say it impacted my life pretty big, especially going through school and stuff. It was quite difficult back then.
What did you learn from being a patient of the Maria Holder Diabetes Center?
I learned that diabetes, don't limit yourself. It's not the end of the world, and that you can do everything a quote-unquote normal person can do, and as long as you have a good support system, you'll be okay. I utilize the diabetes specialist nurse, the pediatrician, the nutritionist, and of course the doctor. The staff there, everybody there is really nice, and they're supportive, and they help me through a lot of my problems. They taught me about calorie counting, learning how to balance my meals so that I can still enjoy the sweet things and everything else that, as I said, quote-unquote normal people can enjoy. They help me not to be insecure about having diabetes. It's something that I have to live with, and to love myself, to be confident in everything I do.
If you are diabetic or pre-diabetic and listening to QFM right now, remember Q also stands for quality. Quality health services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. For more information, call 243-3937 or 417-0305. You can also follow them on Instagram or Facebook. And don't miss next week when we'll be dealing with more diabetic issues. Same Q time, same Q station.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to
reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care.